Greetings. It's Eric back in the Naturopath. And you're still looking at my channel. This is cool. I think this channel's been up for about 8 or 9 years now, so it's a long time. Let's do a video on thyroid, overactive thyroid. So how do you treat an overactive thyroid in a person? Thyroid is certainly a condition that's relevant to my family, because I've had it going back a few generations in my family. So I had some thyroid nodules several years ago. This would have been about probably 10, 15 years ago, even 20 years ago, which I successfully got rid of with iodine and selenium. They disappeared. But my mum had half her thyroid taken out because of overactive thyroid. And in her case, my mother's case, like in a lot of patients I've seen over the years, anxiety and stress and tension seem to be paramount with overactive thyroid. So overactive thyroid patients can be autoimmune or non-autoimmune. Autoimmune meaning you've got antibodies being formed. Diagnosis: autoimmune thyroid disorder with increased formation of autoantibodies that bind to the thyroid stimulating hormone receptors in the thyroid cell membranes and stimulate the gland to function over the top, to hyperfunction. That's Graves' disease or autoimmune hyperthyroid. But I can assure you, you can also have non-autoimmune hyperthyroid like me, and you can also have mixtures of hyper and hypo, and that really mucks the doctors around because they don't like this iffy kind of stuff. They like either black or white. With thyroid, it's all grey. Right? You can have part of the thyroid that's overactive and a part that's underactive, all at the same time. And I've seen it. I've seen people exhibiting symptoms of hyper and hypo a lot in the clinic. Basically, what I'm telling you is the thyroid becomes imbalanced. So how do you get the thyroid back in balance? Let's talk about a few points I've written down here. We're going to talk about the hyper today, not the hypo, not the low thyroid. Low thyroid is, I think, more common. And in fact, if we look at America, North America alone, and probably same as New Zealand and Australia, about 40% of the population roughly have got some form of low functioning thyroid. Now, it can be brought about by adrenal stress, or it can be brought about as a standalone, but often when the thyroid's playing up, it'll be part of a dysfunctional stress axis, including the hypothalamus and the adrenals. There'll usually be some type of an imbalance there. So the first thing I do with hypothyroid patients, I let them talk. I let them sit in the chair and talk for 10, 15 minutes. I observe the rate of speech. I look carefully at their body movements. I look at a lot of things with people. To me, it's all about observation and also these things. These things tend to work quite well when you're sitting with people, because everything that goes in here somehow in there gets converted, to some type of understanding of what's going on. And most people, and any detective or good police officer will tell you this, most people hang themselves on their own admission. They'll tell you they're guilty. They'll tell you what they did. It's the same in a clinic as it is in a police station. It's no different. Except here they don't get any jail sentences, okay? But I have been known to beat people around their head, mind you, with a soft object, like a piece of foam or something. I've always said that smokers need beating around their head with a pillow, and it works. When it comes to hypothyroid, though, patients often have big issues when it comes to their lifestyle in terms of relaxation, anxiety, inability to sit down, take it easy, always wanting to get up and do things. So I'll never forget a case I had several years ago when a husband brought his wife in who was extremely hypothyroid, and she's literally pacing the floor in my room. She couldn't sit down for too long, and I basically said, I've got the perfect solution for this patient, and I know it's going to work really well. And the guy said, I'm so relieved, I'm so happy. And he said, what is it? And I said, well, it's quite old-fashioned. It's called a ball and chain. We've actually put the chain around her ankle and the ball on the ground, and she can't go anywhere. So she's basically, and the guy said to me, that's absurd. I said, no, it's not. I said, look at your wife. She's wearing out my carpet. And I said, sit down, relax. And she sat down, but even when she's sitting down, she's fidgeting. And, hypothyroid really affects the person in different ways. The personality affects the thyroid affects the personality. There's a link there, and when the link is understood and the person makes efforts to Do the nice slow deep breathing to get the heart rate down. Nice slow deep breathing to push the parasympathetic up instead of the sympathetic. And when the person starts really relaxing the body on a deeper level, the thyroid starts responding. I've seen this in an incredible amount of cases. But to try and get a hypothyroid patient to relax, it's probably a bit like getting an atheist to become a bishop, literally, Catholic bishop or whatever. So increase the goitrogen foods. So if you're finding the person is hypothyroid and they've got a very overactive thyroid gland, TSH is really low, not too high, and they've got hormones all over the show, increase the goitrogen foods. So some people call them anti-thyroid foods, but when you start increasing the amount of brassicas you eat, cauliflower, broccoli, bok choy, radishes, apples, cabbage, almonds, soy, walnuts, all these foods help to slowly slow the thyroid function down a little bit. I eat lots of these foods. A big part of my diet is the brassicas, that we grow ourselves. I've got huge, I haven't got my phone here, I was going to show you my cauliflower pictures. We've got cauliflowers bigger than my head, huge. So we grow lots of the Italian Romano, beautiful spirali broccoli, and the purple cauliflower, and all those sort of things. And whatever I have to excess, which is usually the case, I will blanch that and then vacuum pack that goes in the freezer. So I have large amounts of vegetables always frozen, ready to pull out, and they're often the brassicas. I love them. They don't cause me any bloating or gas smell or anything. I'm so used to eating large amounts of these foods now. They're really good, and they've helped my thyroid considerably over the years. The second tip with hypothyroid is check for food intolerances or allergies or sensitivities. I did a video on this just before about stomach aches. So stomach aches is one of the symptoms of a food allergy or sensitivity. Many thyroid patients have got a gut issue that needs sorting out. So check out if there's a food that really, creates a discord with you that's problematic, and get rid of it, because otherwise your immune system is shadow boxing. It's trying to fight and produce antibodies for a food that it doesn't want. This is especially important information if you've got autoimmune disease. You need to get a food allergy panel done in that case, so you can really see if there's any antibodies being developed for certain types of foods. Okay. The third point, decrease the thyroid stimulating antibodies. So this is with autoimmune. You can have up or down antibodies, but if your antibodies are sky high, selenium will help to pull them down. So take 200 to 300 micrograms of selenium. So make sure also you have your zinc levels checked. A chemist can sell you a small bottle of zinc sulfate, this liquid zinc, and you can do what's called a taste test to determine your own zinc levels. Zinc needs to be good with any thyroid problem, and so does selenium. Hair test may be relevant for some people for heavy metal toxicity. I discovered years ago I had a mercury problem, which I cleared from the body when I was in my 30s, late 20s or 30s. So a hair analysis is a good way to determine if you've got mercury or lead or arsenic or cadmium in the body. And the metals can really cause a problem with the thyroid as well. Increase phase 2 liver detoxification. So we call this glucuronidation pathway. You need the sulfhydryl amino acids for this. I spoke about this previously in a video regarding smelly farts and sulfur. So nuts, seeds, grains, legumes are good plant-based sources of these sulfur amino acids, as are the brassicas, which I just mentioned, cauliflower, broccoli, for example. Chickpeas, couscous, eggs, lentils, rolled oats, or steel cut oats, whatever you like. Walnuts. These are all sources of cysteine, which is another sulfhydryl amino. And allium vegetables, of course, onions, garlic. I eat those every day. They're very good sources of sulfur as well, which allow the liver to clear out and to detox. And the other key one I like usually is vitamin C, about 2,000 to 3,000 milligrams per day for hypothyroids. But if you can combine a lifestyle component, especially the relaxation, along with the correct supplementation and diet, it's going to go a huge way towards slowing that thyroid function down. Hypothyroids don't usually have fatigue. And they often, in fact, need to chill out, basically, to slow them down. So if you can relate to that, you watch what happens when you start relaxing more with hypothyroidism and become consciously aware of the tense spots in the body. It's going to make a big difference. Thanks for tuning in.